Hello everyone. So today our topic is about local anesthetics, right? So local anesthetics. So in that first we have to know what is anesthetic or what is meant by anesthesia. So it is a Greek word which means without sensation. So you can also say it as it is a state of controlled temporary loss of sensation. So for temporarily there will be a loss of sensation. Okay. So here the spelling can be varied. It can be the difference is only the A letter. So it can be of any spelling, right? So here we have different types of anesthesia. So first one is general anesthetics, second one is sedation, and third one is regional and local anesthetics, right? So first we will go in detail about what is general anesthetics, what is meant by sedation, and what is meant by regional and local anesthetics, right? So, so general anesthetics. So it affects the whole body. So in case of major surgeries, then you'll be using general anesthetics. Okay, the patient will be completely unconscious for a certain period of time depending upon the dose. So whatever dose you take for that time, depending upon those, there will be a loss of sensation and the patient may be unconscious. That is general anesthetics. Okay, or we call it as general anesthesia. So it affects the whole body, making the patient unconscious and unable to move. Okay, so without this general anesthetics, we cannot go for major operations because because there will be a lot of pain during the surgeries. So we need to take general anesthetics. So in case of any open heart surgeries, brain surgeries, and other organ transplantations, we'll be going for general anesthetics. Depending upon the body weight, the doses will be different. So that is general anesthetics. This is already there in your second year. So coming to the next one is sedation. So sedation is it is only the suppressing the CNS for only lesser degree. Nothing but it will be reducing the anxiety. That's all. So sedation, it suppresses the central nervous system to a lesser degree by reducing the anxiety. So that is sedation. So and lastly, coming to the regional anesthetics and local anesthetics. So these regional anesthetic, they will affect the larger areas. So whenever you're having any arm injuries or any breaking of arms during the accidents, you'll be going for regional anesthetics. So whenever there is an injury in the arm or leg or even near the waist, then you'll be going for taking general anesthetic to lose the pain. Okay, so loss of sensation so that any treatment while doing the treatment you'll not have any sensation, you'll not face any pains. So example here we have, so it is for hand and the joint surgeries. So even in case of C-sections, right, even in case of the pain of childbirth or that is nothing but the C-section deliveries, you'll be given regional anesthetics so that there will be no pain. So that is about regional anesthetics. So coming to the local anesthetics. So this is only affect only a small part of the body. So mainly like when you're having any tooth infections, tooth decays. So that tooth should be removed. In that case, you'll be going for local anesthetics. Even here we have the examples. So they often used in like tooth surgeries, or you can be used for cleaning the tooths. I mean, complete root canal treatment will be there. In that cases also, you will be given the local anesthetics, right? Here you also we have one more example. So any small skin growths like warts, corns, so those also can be removed. Like pimples, all the big pimples will be there. That will be they cause a lot of pain. For their removal also, you can go for local anesthetics. There will be that part of the area becomes numb. That part, only that part of the area becomes numb, so that you don't have any pain. So that is local anesthetic, right? So here till now we discussed about what is anesthetics, types of anesthetics. In that first one we discussed about general anesthetics, then sedation, then regional and local anesthetics. So general anesthetics is used for major surgeries, major operations. Then sedation only to reduce the anxiety. Then regional anesthetics, a part complete like hand operations or leg operations. Okay, in that cases you will be taking the regional anesthetics. Then coming to the local anesthetic, only a part, very small part of the body can be made numb. So this is the introduction of the types of anesthetics and anesthesia. Now going in detail into the local anesthetics. So first we will discuss when we'll be using this local anesthetics. So these are mainly used in minor surgeries, right? And then here the patient will not get unconscious. Only that part of the area becomes numb. That's all. It loses sensation, but the patient will be conscious. In case of general, the patient becomes unconscious. Okay, and this is done very quickly. Immediately, this part of that area becomes numb. So you need not to stay in the hospital for the whole night. Then, so these are the uses of local anesthetics. Right. Coming to the mechanism of action. So generally, this is the resting phase, this is the activated state, and this is the inactivated state, right? In the resting phase, the sodium channel will be closed. Generally, this is the extracellular space and this is intracellular space. So the sodium is, whenever this channel is activated, sodium is influxed inside, which causes depolarization. But in resting phase, the channel is closed, so sodium is not influxed and there is no depolarization. So when the depolarization is started, only the impulse is produced. So here, so the sodium, so whenever the sodium is influxed, which leads to impulse production. So what our local anesthetics do is, for example, this BH is the local anesthetics, which is having a proton. So slowly the local anesthetic, when administered, the proton gets separated. Then the drug is infused between the membrane. Through the lipid layer, it is infused into the inner membrane. And the proton is influxed along with the sodium when it is in activated phase. So now what is happening here, the local anesthetic again combines with the proton and slowly it gets deposited, it will slowly bind to the receptor. This is the local anesthetic receptor. So it's already here. This is the local anesthetic receptor. Now slowly this local anesthetic will go and bind to this receptor on this sodium channel. So what happens is the channel will be closed. Though there is no influx of sodium. When there is no influx of sodium, depolarization is not done and impulse is not produced. Because of that, you will lose sensation. So this is the mechanism of all the local anesthetics. So resting phase, activated phase and inactivated phase. This is not resting phase, inactivated state. Because if it is in the resting stage, immediately whenever required, the channels get activated. When the sodium levels are high, the channels get activated and they get cause depolarization, right? But by taking the local anesthetics, completely inactivated will be done for required period of time, depending upon the dose. And that also depends on the body weight. Okay, so this is the mechanism of local anesthetics, right? So the sodium channels play a key role in this. The influx of sodium is blocked by the local anesthetics. That is the mechanism of action of local anesthetics. So coming to the classification. So generally these local anesthetics are classified into two groups. So amide group and ester group. So whatever compounds containing amide group, they belong to this. For example, lidocaine, prilocaine, mepivacin, etc. Okay, they are most commonly used. Okay, this is classified again based on the chemical structure. Generally, we have one more classification in this, that is based on the site of action and duration of action, you can say. So here we have the first one is amide group. So I already said examples are lidocaine, prilocaine, mepivacaine, etc. And second one is ester groups. So they are procaine, tetracaine. So generally they have a little bit of side effects. So generally they cause allergic reactions or a bit of toxicity is caused. So these are not that much prescribed. Okay. So this is amide group and ester group. Coming to the drugs. So these are the local anesthetics which contain the ester group and these are amide group drugs. And here we have a duration of action of them. For example, here procaine, it's having a short duration of action and chloroprocaine is also having a short duration of action. Benzocaine, a short duration of action, but tetracaine is having long duration of action. So depending upon their duration of action, they will be administered. And also one more important point, depending upon the body weight, the drug will be varied. Next, coming to the amide type of local anesthetic. First one is lidocaine, which is an intermediate duration of action. Prilocaine is also intermediate duration of action. Mepivacaine is also an intermediate duration of action. Coming to uh, bupivacaine, it's a having a long duration of action. Next one we have is etidocaine, and also last we have ropivacaine. These both are also having a long duration of action. These are the drugs. So we'll go in detail about their structure and their synthesis, right? So first one going to benzoic acid derivatives. Example, we have cocaine. So this is the benzoic acid structure. Okay. So this is benzene having carboxylic group, COO. This hydrogen can be any group. And this, this hydrogen is nothing but R. This R can be any group and this R can be any group, right? So here it can be hydrogen or any substitutions can be done. So that we'll discuss in detail in the structure activity relationship. So coming to the structure of cocaine. See here having the benzene, which is attached to two carboxylic groups. Then it is attached to, see here you have 1, 2, 3, 4, 5, 6, 7. So it's a 7-member ring, right? So you can draw this in a sugar moiety type ring, right? So which is attached to nitrogen here. Both the rings here, they are attached to the nitrogen. Again, here you have one more carboxylic group, right? So this is this cocaine, when it is taken in 2% concentration, topically it is applied in the, you can apply to the ear, nose, throat, rectum and vagina. Okay. If there is an infection or a pain in the ear, nose, throat, rectum and vagina, only a 2%. So nothing but 2%, you know, the concentrations. So 2% of cocaine can be applied topically on the skin only, not internally. It is not used. It is used only topically. Okay. So this is about cocaine. Coming to the next drug, this is hexalkane hydrochloride. So this is the structure of hexalkane hydrochloride. So here you have a benzene carboxylic group. So this R is substituted with the ethyl chain and with the piperidine ring, a saturated form of, cyclohexane. So saturated form of benzene ring is nothing but cyclohexane. So this is also used on surface. So generally it is called as surface anesthesia. So it is also used only topically. Next drug we have is cyclomethylcaine. Cyclomethylcaine. So here this is the benzene ring, carboxylic group, and ethyl chain, but this is now piperidine. Nitrogen in the saturated form of, generally if it is unsaturated, it is pyridine. As it is in a saturated form, we call it as piperidine. Now, see here, in the general structure, here we have R group. Now here that R group is substituted with a benzoxy group, cyclohexoxy group. Okay. So that is why it's called cyclomethylcaine. So it is used for pain and damaged skin, right? For the mucous membrane of rectum, vagina and urinary bladder. It is mainly used to lose the pain. Mainly can be applied on the damaged skin and also can be applied on the mucous membranes of rectum, vagina and urinary bladder. So this is about cyclomethylcaine. Next drug is meprilcaine. So generally the other name for this meprilcaine is epirocaine or oracaine. So here you have a benzoic group and you have a substituted side chain. So here we don't have a ring here. So it is also used as a local anesthetic. Then we have piperocaine. The last drug under benzoic acid that we will be discussing now is piperocaine. So here you have the benzoxy group and it is again a side chain. We have a piperidine ring. So you can compare and write the structures. It is used for mainly eye and throat treatments. Mainly used to treat eye and throat treatments.